Okay. Hello to everyone who is watching this discussion today on the Bristol to Beijing channel or via our YouTube. It's fantastic to have you all here watching. Today we are going to discuss the question of going beyond being a cancer survivor. Today is the 7th of June 2020, and in the US and the UK it is Cancer Survivor Day. And cancer survivor is a term that I've found quite difficult in some ways to get to grips with. And the purpose of this discussion with my three amazing guests is to go a bit deeper into what it means to have a cancer diagnosis and perhaps how we choose to identify ourselves or not. And this could be, from using or not using the word cancer survivor. I have coined the term can liver, which is someone who has a cancer diagnosis, but also acknowledges there are challenges, but also opportunities that go with this, which is also not perfect. I've had it termed sounding a bit like cat food, or something you might serve up for breakfast, so that there's work to be done. So this is really going to be a discussion which aims to deliver a bit more depth and nuance to a debate that can often come across as quite crude and militaristic. The battle, the fight, the struggle against that we either win or lose. This aims to go hopefully significantly deeper than that. To begin with, I would like to introduce the three amazing guests that I met all through the Bristol to Beijing cycle ride, and I thank you all so much for giving up your time today. Miranda, can we start with you?
Yeah, hi Luke. Thank you very much, first of all, for inviting me to get involved in this discussion, and also thank you for allowing me to cycle with you from Canterbury to Dover. It was a very, very wet day, very cold day, but we had a fantastic time. So I'm Miranda. I was diagnosed in November 2017 with stage 2 invasive ductal carcinoma, which is breast cancer in my right breast. I underwent a lumpectomy and radiotherapy and finished my active treatment in March 2018. I'm now on a 5-year plan of something called a aromatase inhibitor, which basically strips your body of estrogen to try and stop the cancer recurring and reducing the risk of that happening. 2.5 years later, here I am. I've got quite a lot to say about it, but we'll wait until we get into discussions on that. But thank you, and I'm looking forward to meeting both Kirsty and Kate.
Brilliant, thank you, Miranda. Kirsty.
Good to see you again, and good to be here, and yeah, talking about some interesting things, I think, coming up. So my name's Kirsty Levasseur. I was diagnosed with bowel cancer just over 7 years ago now, when I was 31. All came as a very, very big shock. I had surgery and lots of chemotherapy during that first year, and touching lots of wood, have been okay since. I was also obviously looked into why I had cancer at such a young age, and subsequently found out that I'd got something called Lynch syndrome, which increases the risk of various different cancers. So I've got a genetic mutation that we have to kind of keep an eye on things from that point of view as well. Just to complicate things even more, I'm a doctor, so there's been lots of interesting situations in terms of what it's like being a doctor, having cancer and going through stuff. But I suppose biggest things for me is that over the last 7 years, I've done probably more living than I'd done in the previous 20 odd years, and experience wise and travel and exercise have been really important in my life, and yeah, actually had a good few years.
That's awesome to hear. Thank you, Kirsty. And Kate.
Hello, I'm Kate. I was diagnosed with adrenocortical carcinoma on the 21st of June 2018, after surgery, which was to remove what the doctors believed was definitely a benign lump. So it was a bit of a shock to be told that actually I had cancer. I am on a 2-year course of daily chemotherapy, so I'm still taking chemotherapy now. and the chemotherapy means that I have lost all steroid function in my body. Yeah, it produces all of that as well. I feel like I've got sort of thoughts, opinions, and yeah, I'm not sure cancer survivor is necessarily something I like as a term.
Okay, so thank you all, and we'll get stuck into that very shortly. And I should say, you know, this is a discussion that's really very much about trying to explore that there are no right or wrongs. Each person has to deal with this in their own way, and for anyone watching, take what is useful from this, from what any or each of us say, and discard the rest. If something doesn't seem like it's good to you, then by all means, don't pay attention. Make sure you do what works for you. For those of you who don't know, my name is Luke Grenfell-Shaw, and in 2018 I was diagnosed with a stage 4 sarcoma. The outlook was pretty bleak, but I'm very happy to be here, incredibly happy to be here. 2 years later, or almost to the day after I received my first diagnosis. So hopefully that gives you all a bit of background of some of a very small vignette of the journey that we've all been on. To start with, we're going to have about 3 minutes each to, without really, this isn't a dialogue, time for dialogue, that will come later, but to talk about our own relationship with these terms, cancer survivor, can liver, what we find useful, what we don't. So it's really, the floor is for each person in turn for about 3 minutes. And we'll go in the same order that we did before. So Miranda.
Thank you, Luke. I mean, it's a tricky one, isn't it? When I was first diagnosed, the impact of being told you have cancer for me, was huge. I always knew deep down that I was going to get breast cancer in my right breast from about the last 10, 15 years previous to that. And I always thought that when that happened, I would be able to cope. But actually, I didn't. And I think the fact that I didn't cope very well made me even more upset about the whole thing. Obviously, it had a massive impact on my physical well-being, but I think the one thing that hugely has come out of this is the mental well-being, or the lack of mental well-being that it had on me. The impact of not being able to cope physically and mentally was a real struggle. So for 2 years, I've continued on, and I've got stronger and I've got better, and I've also tried to identify why I had cancer. I was fit, I was thin, I was didn't drink, ate well, all of those things. And you realise that actually that has very little impact when you have it. And I'm now continuing to do all of those things, keep fit, try and get better. So 2.5 years down the line, how do I feel? Do I feel that I'm a survivor? Well, yes, I've had cancer. And if I meet somebody that doesn't know me and it comes up, I say, I have had cancer. Am I living with cancer? Well, the answer, the short-term answer is no, I'm not living with cancer, but I am living with cancer in my head, because every day there's always that niggle. Is it there? I think my body is free of it, and I hope my body is free of it, even though I'm still undergoing treatment. So every single day in the back of my mind, I get an ache, I get a pain, and I'm sure this is the same with everybody, at least with a lot of people, particularly if they've had a good diagnosis. There is still that concern. Have I got a cough? Why have I got a cough? Is it in my lungs? Is it in my chest? And so it goes on. And I think what I can take from this is that I have a much deeper insight into how people that have gone through, are going through a cancer experience. I think I have a deeper insight into not necessarily what they're feeling, but some of the things that they may be feeling. And I am trying with my life to go forward to empathise, support and inspire others, very similar to yourself, Luke, And whether it is you're happy with the word cancer survivor, whether you're happy with the word can liver, I actually think can liver sounds a bit like cancer of the liver, but you know, we all look at it differently. I am a survivor. I have come through it, but I wouldn't call myself that. I would just say I have had cancer, and to everybody that it's been and it's done, and in the back of my head it's not. So I suppose that's where I am on this experience and this journey, if that's what you want to call it, although I'd rather not call it a journey, because you associate journeys with good things. But similar to Kate, I've grasped life with both hands, and I'm trying to live life to the full. So that's sort of my little resume of where I am on the can liver, can survivor, had cancer, not had cancer, not got cancer. Yeah.
Oh, thank you so much, Miranda. There's a huge amount there, and I'm really looking forward to digging into that in a second. Kirsty, can you give us a flavour?
Yeah, so I mean, I've never really liked the term cancer survivor, I have to say. I think if you kind of look at the actual definition of, you know, survivor, then I think it's more of it's something that you could use when you're getting over quite a kind of acute thing. You know, you survived a car crash, or I'd be happy to say that I survived my surgery. But I think it gets a lot more complicated when you're then thinking about something that, as Miranda was saying, is quite highly likely to leave you with other after effects, really. I mean, even when I was first diagnosed, things looked really quite positive, and we were talking about curative surgery and chemotherapy. But even at that point, possibly, I suppose, being medical myself, I was all too aware of the chances of, you know, that not being the case and things recurring. And so I would never have wanted to put that term survivor to call myself that, because I think I'd have just been felt like I would have been tempting fate. And then, as it was, actually, whilst I was having the first lot of chemotherapy, I had what everybody thought was a recurrence that then very much changed the way people were talking. So we were then not talking about curative treatment; we were talking about palliative chemotherapy. And I, you know, clearly at that point, really didn't feel like a survivor, and thought, you know, this was going to be it. And I think at various points I've tried to come up with a better term. I've failed miserably. I think one of the things that probably drew me to getting in touch with a random bloke on the internet to ride on the back of his tandem was actually not necessarily the phrase can liver, but certainly what it encompassed, and the concepts there in terms of living with or following a cancer diagnosis as richly and fully as possibly. And I think it's actually it's something that's really hard to come up with a really good one or two word thing to describe it, and it's the kind of broader concepts that I think are perhaps important, although everybody wants a catchphrase, don't they, for everything. And I suppose the only other, from a medical point of view, I've probably felt more comfortable, or have felt comfortable generally when talking to other people, talking about things in very medical terms. So, you know, I am a person who had surgery and chemotherapy for bowel cancer, and as of last September had no radiological evidence of disease, i.e. nothing to show any cancer on a scan. And I think that's kind of what I've told myself, and if anybody to asks, that's what I'd say I was. But that certainly doesn't talk or explain enough about everything else that has happened since.
Thank you, Kirsty. Again, another different perspective, a different experience, and some really interesting points in there as well. Kate?
I think Miranda and Kirsty have sort of covered quite a lot there. I would say, because the form of treatment I'm on is quite different to traditional forms of intravenous chemotherapy, in that I'm taking tablets every single day. It's meant that the past 2 years have felt far more medicalized, and at times I felt like I've lost the sense of myself, really. I've spent an enormous amount of time as an inpatient, either because of complications or because I've had adrenal crises where my steroid levels have just dropped completely and I've been hospitalized, unconscious. So that sort of takes away, or took away for a long time, my feelings of identity. But there again, when I'd leave the hospital, every single time I'd leave the hospital, I would want to go back to being me. And I found that was hard at times, especially when you're feeling sick all the time, when at times I was too weak to walk up the stairs. It's been, I mean, a long old slog, I'd say, really, rather than a journey or a battle. It's been a slog. And it's also, I feel as though I'm living from scan to scan, which is something that I don't know whether you guys might agree with. But that might be because I'm still sort of undergoing treatment. And yeah, again, it was something that came completely out of the blue, diagnosed at age 31. And as I said, before diagnosed, after surgery to remove what the doctors were determined and convinced was a benign, non-cancerous lump on my adrenal gland.
Thank you, Kate. And I'll finish with just a little bit about myself, though if you've been following the page, you might have had a flavour of what I have spoken already. And today, on the 7th of June, I released a blog post entitled "Why I'm Not a Cancer Survivor," which gives you a flavour again of my disposition. The type of cancer I have is not one that's some people might use the word incurable. I think that's a very unhelpful word. I always think of it as life-threatening, but I think it's useful as a descriptor of the sort of why I think that the term cancer survivor, which gives you this idea of certainty, an appearance of certainty in the future that you're a survivor, and you've beaten your disease. That's not something I ever felt I could relate to, because for me, and this is something that I think to an extent we've all alluded to, we don't, even if a scan comes clean and we are cancer free, which is another term that I personally like, because you can have proto-cancerous cells that then become cancer, which don't show up on scans. There's very little certainty, and so I prefer a term that embraces the uncertainty and recognizes that there, at least from my perspective, there isn't an end point or a sort of a safe zone, if you like, and it's something that has to be dealt with on a day-by-day basis, but that doesn't stop us from living a very rich and full life. So we've already covered a lot of ground, and now we get into the juicy bit of discussion. We've got about 20 minutes, just under 20 minutes for this. I'm, for no particular reason other than this is what came up first. Miranda, I was intrigued by, you said, well, first of all, you didn't identify with either the terms cancer survivor or the cat food brand CanLiver, but you said, you would say, I've had cancer, but it's still in my head. And I feel that could be a really interesting starting point for discussion.
Yes, and I think that, interestingly, just picking up on a point that I think it was Kate said, or possibly Kirsty, about tablets, taking tablets every day. When I first started having to take tablets every day, and that was, I felt exactly the same. It was a loss of a loss of yourself. And I was so angry that had been put in a position where I had to take something I didn't want to take. Yes, the radiotherapy I felt I needed. Yes, the treatment, the surgery I needed. But then to have to take a tablet for 5 years when I've never taken anything, it made me very, very angry. I think I've moved on from that anger. And now I accept it. I still have to set my alarm every day to remind myself to do it 2.5 years down the line. Sorry, Luke, I've sort of diverted a little bit, so I've taken away from that cancer survivor.
No. This is all about exploring the issue.
Yeah, and I think I have had cancer and it is in my head, and 2.5 years later, that trigger in my head is still there, but it's not as huge. It's not taking up 95% of my headspace. It's probably taking up 50% of my headspace. And it's always there. And I'm hoping, and having spoken to others, that it does take up less of your headspace as time goes on. But I don't think it's ever going to go. Until such times as it does come back, or I die of old age, or get run over by a bus, or whatever it is. But it is that mental attitude, and it's having to be strong about that mental attitude. It's having to not allow others to see it. That's the way I look at it. I don't want others to worry about me worrying. That's why I say I have had cancer and I'm now fine, because I don't want to put that responsibility on anybody else.
I would like to say I agree with you a lot there. Like, it takes up a lot of headspace, and sometimes I find that I feel quite sad about it. I feel that, like, why me? Why like, it's not fair. Why not, so and so? And also, but bizarrely, there seemed to be like a loneliness to the sadness for a lot of the first like 6 months to a year, because I felt like this was happening to me, to my body. It was something I couldn't control. It was something that was meaning that my parents were having to care for me. My husband was having to care for me, and I was reliant on so many people around me. Because I take 30+ pills a day, which is a worrying number. And it just, at times there's days when you just feel like, I really don't want to take this medicine. I don't want to take this chemotherapy. I don't want to take these steroids. I don't want to take these anti-nausea drugs. But equally, I know that I have to. And that's a real confliction there. Real conflict.
And I think actually that brings something up, that it's a bit like you say, you're taking 30 tablets and I'm taking 1 tablet, and that then immediately makes me feel, what am I making a fuss about? But it's a bit like the friends I've met through this, they've had mastectomies and chemotherapy, and I had radiotherapy and a lumpectomy. So in effect, I was lucky that I didn't go through that. But actually, I wasn't lucky because I had cancer. And I think we all have individual experiences, and everybody looks at it in a different way, whether it's good, bad, indifferent, ugly, or whatever. So the empathy has to be the same for all. However, I think this is the way I see it. I think I am lucky because I'm not taking 30 drugs a day, but it's still, as you say, taking up a lot of your headspace.
Kirsty, what about for you? Is this something that takes up a lot of headspace and 7 years down the line?
So yeah, I think that's interesting, isn't it? It's less, but actually it's probably only in about the last year or two, that I would say that I've really, and it's not because I've necessarily changed an opinion on the fact that I do think that I've, nothing awful is going to happen in the future at all. It's literally, I think, just because so many other things have happened in the meantime. But I mean, if I was to put a percentage on it now, I'd probably be down at kind of 5 to 10% most of the time. But equally, it's still very much something that I can't completely forget about, and I can't just say, pretend it never happened, because there are so many things that are still in my life that I kind of, you think, well, this hasn't happened, and it's still related to cancer. There's still a lot of stuff, and I haven't kind of progressed quite as quickly in my career as I would have done otherwise, and I've made career choices that are probably different because of that. So it's still, even 7 years down the line, it's still impacting. And again, I think that's probably one of the reasons that I wouldn't use such a definite word like survivor to describe something, because it's still there. Having said that, I suppose trying to think of another word that kind of encompasses the enormity of what has happened in the past, and that you're kind of back to a more normal way of life is also difficult.
Yeah, I certainly think from my own, career perspective, that's radically changed on what my expectations of, what's the point of having a 5-year plan if 5 years seems like really rather a long time away.
And I think so. Actually, the other thing, so I haven't had any 5 or 10 or any kind of year plans. And going back to what Kate said, I certainly at the start I was very much living every 3 to 4 months between scans, and I wouldn't plan anything that was beyond the next scan in terms of a holiday or anything. But what I kind of did realise is that it was helpful not to make any choices that would potentially limit things further down the line. So, just to kind of, I was able, thankfully, to carry on kind of chugging along and get back to work. And it wasn't necessarily in the same way that I had been before, but just being there meant that there was still the opportunity in the future to go more slowly, but to kind of potentially end up where I wanted to.
There's you brought something out which I hadn't thought about for a while, but I really want to sound you guys out on. Ladies, amazing company. Sometimes with, you said you've got, one has a cancer diagnosis. There's this sort of, can be this idea of getting wrapped in cotton wool that, oh, you've got cancer, we need to do everything for you. Are you sure you can go outside? Are you sure you want to keep on working? Are you okay to do this, that, or the other? Which I think can have that impact of being very debilitating even further, and as you say, then close off other doors without even you realizing it. So I was wondering if there was anything in there that Kate, you could relate to, and then Miranda, and then back into Kirsty.
Yeah, I mean, definitely the whole being wrapped up in cotton wool, that's something that I'm sort of torn with, because I don't want to be wrapped up in cotton wool, but as my husband says, I have a very short memory, and I will go on the bike and push myself, or go for a run and push myself, and then end up in a bad way the following day and having to spend the whole of the rest of the day in bed because of the fatigue that overcomes me. So to a certain extent, I can't always be trusted to make the right decisions for myself as much as I would like to, but I do find it irritating when people just think that all they can talk to me about is cancer. And actually, the friendships that have survived through this have been the ones that have been built on not doing things, because there's been a lot of times when I haven't been able to do things. I haven't been able to go out for dinner. I haven't been able to make plans, as I think Kirsty said. The friendships that have been based on actual communication and shared interests. And
Gone very quiet here, Kate.
people that have been there.
Yeah, you were very quiet for a bit. Just in the interest of time, because we've only got 7 minutes left, I really want to return to that theme, Kate, about how you're treated with cancer, people who don't just talk to you about and cancer. Miranda, coming back to the cotton wool, the expectations question, what are your thoughts?
Yeah, so for me, I once treatment was over, my active treatment was over, I thought everybody would expect me to be back to normal, and I wasn't. But I put that expectation on myself, actually, which was quite interesting. So although people were treating me normally and they weren't wrapping me up in cotton wool, I thought that they were expecting me to be 100%. But it wasn't their expectation, it was my expectation. It was because I wanted to be good and well and fit and healthy and no longer fatigued. And I have to say, nobody really did wrap me up in wool, up in cotton wool. And I was probably very similar to Kate in that I did, I pushed myself too hard. I worked through treatment. I, cycled. I walked. I did all of those things, and then realised that actually, and it has taken me this length of time to realise that I have to look after my body and listen to myself. And however much anybody else told me that, I wasn't prepared to listen to them. So a little bit of stubbornness coming in there.
Right. To what extent do you feel that was a not that you can have your time again, well, hopefully you don't have your time again, but like, to what extent would you want to keep that, that stubbornness of going out for your runs and being active, even if it sounds like you think it was a bit too much?
Yeah, I actually think that it's taught me a lot. So I think that, because I thought self-care was you'd have a bath and you would, you'd have a few candles. And I also thought self-care was about, pushing yourself hard. And I've actually learned that self-care isn't about pushing yourself hard. Self-care is about doing what you need to and want to do, but not necessarily doing your 50-mile bike ride 3 times a week. I've learned a lot. So I think going back, if I ever went through that again, I would certainly look at it slightly differently and take a slightly different attitude towards it. But I still like to be pushed. I still like to push myself, even if that does mean I'm absolutely exhausted for the next 2 days, because that's me.
Kirsty, what are your thoughts?
So I suppose I think quite a lot of the comments that I had from other people, I at the time they would wind me up, but I think looking back, it was actually kind of other people putting their what they would do if they were in my situation, or what they thought they would do if they were in my situation. So that was the kind of, I wouldn't be going back to work if I was you. That was because either they didn't particularly want to be at work themselves at all, or they thought in that situation that wasn't what they wanted to do. And so that was, I found that really difficult to be getting other people's kind of opinions, really. And I just wanted to say, you don't know what I'm thinking or what I want to do, so maybe just listen and we can talk about it, but don't just tell me things that aren't helpful. And I suppose that I didn't push myself particularly hard as I was kind of coming out of chemo, and part of that was because everything was so uncertain that I think I'd have been more tempted to, and my psychology to start off with was, I'll have chemo and then everything will just go back to normal. And in that situation, I would have probably gone back to doing the same job with nights and weekends and pushing myself as hard as possible, whereas actually I'd kind of realized that I think taking it a bit more slowly and enjoying everything else along the way was going to be the way forward.
I think there are two really interesting things there, at least two interesting things in what all of you have said about this idea of self-care. I think part of that is kind of understanding what is important. Is that doing lots of long hours, working? And then this other idea of, what's the right balance? And there can be a temptation or a thought that the best thing to do, perhaps when going through chemotherapy, is to lie in bed all day to preserve your energy. And I think probably that's an option of last resort, because if you think at any other point, were you to lie in bed for a week at a time, that would not be a very healthy thing to do. So I think trying to be as active as possible within reason, that probably doesn't mean going for 50-mile rides. It is a very positive thing, trying to still keep us active, and that's probably more than a lot of people realize. We've got 2 minutes left. So could we have 30 seconds from each of you of give us one thing that you've really liked or appreciated the way that people have interacted with you when you were going through your cancer journey? And I'll start with a quick example of just saying, my friends from university were amazing at just making things feel normal. And although I didn't have any hair, I didn't have any eyebrows, we would chat and go for a walk and have a beer, as we always would. And for me, having that a bit of normality was very precious. Miranda.
Yeah, funnily enough, actually, I would concur with that. My university friends, obviously, which was a few years before you, Luke, when I went to university. They were brilliant. They were exactly the same. They treated me as normal, and they asked how I wanted to be treated, and I think that was very, very important.
Kirsty.
Slightly different. Just thinking about some of the kind of healthcare professionals that were involved and looked after me, and I think the really nice, or the ones that you jump out, and I can remember the ones that knew a bit about me as Kirsty, as opposed to as a patient, and knew what I was into and what I liked, and would ask about the nice restaurants that I'd been to and things like that, and yeah, that just made a big difference.
Kate.
I would say, again, friendships have really changed for me. University friends are the ones that have come to the fore, because I guess they're the friends that you make over a long period of time, and that you make over sort of mixed circumstances.
Kate, I'm really sorry to cut you off, but the connection's going. We've only got 40 minutes. Thank you to everyone who's watched. Thank you to you all for